We're live.
Ladies, there's a new emerging branch of medical science that involves functional restoration of your tissues and organs. And we today have someone very special, Dr. Esther Webb. Welcome, Dr. Webb. How are you today?
Doing well. Thank you, Trish. Thank you for having me, and Merry Christmas to everyone tuned in.
Great. We're going to learn today about stem cells and PRP. Hi, I'm Trish Gleason. Let's get started. I'd like to tell you a little bit about Dr. Webb. We're excited to hear what she's got to say to us today. She's a doctor of nursing practice. She specializes in aesthetic medicine. She's got her postmaster's in midwifery. She's also got a master's in family practice. And I definitely love their office. They have an office here in Gainesville, Florida called Accent Aesthetics. So welcome, Dr. Webb.
Thank you.
We've got some great questions lined up from you. Some of our audience has prepared a few, and then of course I've got mine. So let's get started. What in the world is stem cell replacement in the first place?
So stem cells can be used to help regenerate and heal tissue. It can be derived in a few different ways. One is from our body, and one is from donor stem cell, get stem cells in that manner. So it can heal tissues in our face, in our ligaments, dental, all different ways it's used.
Okay, so we'll get into it a little more details, but for example, well, you specialize in aesthetics. So this is used to, what do you mean? Stem cell replacement, they take blood out of your body and reproduce it, or stem cells, or what is it exactly?
So for in my office, I use platelet-rich plasma in combination with donor stem cells, a stem cell product, to help regenerate tissue. We can form new blood vessels, help regenerate fat pads in the face, because that's one of the ways we age, help with a nice natural glow, because again, those blood vessels I mentioned help improve blood flow and circulation to our tissues. So if I have a question, I'm sure the rest of the ladies do too. So I'm still not sure. PRP, platelet-rich plasma. Is this using my own plasma? Yes.
So I don't have any more because I'm getting older, or what's the deal?
So platelet-rich plasma, you come into the office, we draw your blood, we spin it down, we isolate the platelets and keep it in your own plasma. And then I inject it into your tissue. And platelets, if you know what platelets are, they show up and they stop bleeding if someone was injured. But they don't only just do that, they show up and they send out signals to the rest of our body to recruit our stem cells that are in our own systems, in our own bodies, to show up and heal. So platelet-rich plasma is one way to recruit stem cells in our own body. But then we can also use an additional stem cell product or derived from our own system to improve that healing capabilities that PRP has.
So let's get it straight. If I have platelets, you take them out, but they're not as exciting as you wanted, then you're going to add stem cells to them? Is that right?
As we age, we do have fewer and fewer circulating stem cells in our body. And so over the age of 40, I recommend that my patients consider adding a stem cell product that is derived from amnion or placenta to their treatment, because like I said, our stem cells dwindle, and so we don't have the healing capabilities as said we did when we were 20 years old. You know, you heal quicker, heal better. So I can augment that PRP with a donor PRP to help improve the healing and the tissue.
Okay. Well, I haven't done it yet, but when I do, could you get mine from a 20-year-old? It sounds risky, but I'm sure it's not. So tell me, what are the, if I'm going to use somebody else's platelets, right, or stem cells, and how do I know they're not giving me some sickness or something? Let's talk about that a little bit.
So using an FDA approved process. The stem cells, the amnion is irradiated, and also it's screened as if, let's say that you're having an organ transplant, and all the different screenings they go through for organ transplant is also done on this tissue, this stem cell tissue, to ensure that there are no germs.
Okay, it's just like the Red Cross. When you donate blood and you get blood from the Red Cross, you know it's good. This is the same thing?
Exactly right. Exactly right.
Okay, great. That's great. Okay, so I come in, let me back up real quick. So stem cell and PRP, they go together. You can use them for dental and joints. So I'm interested because my dad's 90 years old and he's got a bum knee. So right. How can this help somebody like my dad? Or if a lot of our listeners or people watching have relatives that have a problem, how can it help?
So I personally don't do joint injections. So I would first do a disclaimer. So I don't do that.
And we're not giving medical advice today either. We're correct. Just giving them information. That's
correct. So platelet-rich plasma can heal, and stem cells can heal a multitude of issues. Like you mentioned, the 90-year-old father with the injured knee, injecting the PRP, the stem cells into that area are going to help improve the blood flow, heal the tissue. Stem cells can become any tissue that is there. So let's say you inject the PRP, stem cells from your own body show up. They're generic cells and they can morph into whatever tissue they need to be.
So what is it, like my dad, because let's use that as an example. My dad's knee, you shoot it in there. What's that tell his body? Hey, bring a bunch of help here and grow new.
Exactly.
What else? What does it grow new of?
New blood vessels, okay. Supplies nutrients. It can actually turn into the type of tissue, whether it's his ligament that needs to be repaired, whether it's his cartilage that needs to be repaired, even bone to a certain degree, will help. It'll turn into whatever cells it needs to be and starts healing and repairing and forming new tissue, whatever tissue that is. Does that make sense?
Yes. Oh my gosh. Right. So let's talk about downtime. So let's say I come in, I want to get more plump like I was when I was 30 or 20. So right. I want to come and I want to do a treatment. First of all, I want to know the downtime, and then we want to talk. I know you're not selling because you're just educating everybody, but you can give us a range on costs.
Okay.
Time. I come in, it's a Thursday morning. How long am I going to be under the covers?
So you're going to be with us about an hour to maybe an hour and a half, depending on which treatment you have. And the reason you're here so long is because it takes time to process your blood, to isolate your platelets. So you're here just depending on which procedure it is. So the vampire facial, you'll be here for an hour to hour and a half.
What do you mean vampire facial? Nobody knows what that is. What is that?
So a vampire facial is microneedling, which is a controlled injury to the skin, which stimulates your body to form new cells, repair new collagen, helps smooth the skin, helps shrink pore size. And then with the addition of PRP, which is applied topically, so it absorbs in through those little microneedle channels that were created. And then I actually inject, because I make injectable grade PRP here, inject the PRP into the tissue to heal from the inside out as well. So
you do it on your neck, chest, shoulders, the whole works?
Wherever you have skin. Yes. Yes.
Okay, then so then how long? I go home. Do I need somebody to drive me home?
No, not unless, now I do offer my patients that if they were nervous about it, I would offer them something to make them relax. So at that point, yes, they need someone to drive them, but otherwise, no, they're totally fine to drive themselves home. They probably want to stay at home for at least 6 hours or so, allow the redness to kind of subside, because the microneedling can cause some redness. And then I put such a large volume of your PRP into your skin, into your face. When you leave here, you'll look somewhat swollen, but it'll absorbs in. And then you're back to normal, except for maybe some minor bruising if you bruise.
Okay, so let's talk about bruising, and then we still got to get back to the money thing. But bruising, I know I've heard of this something called arnica that people take to reduce bruising. Is that something you would suggest? What is it?
So arnica is a homeopathic medicine that absolutely reacts to inflammation in our body. Inflammation, bruising, it helps heal, it helps clear, helps make the yellow, the green, the blues go away from the bruising much, much quicker. It's an herbal supplement, been around for thousands of years. It's fantastic.
Okay, great. So I have heard that works brilliantly. So that's, would they take it right when they got to your office, you said? Say, or?
Yes, so as soon as they're in my office, once I put a needle into their skin, which is trauma, I say, here, take your arnica, and I send them home with the arnica, and they know their regiment for the next few days.
Because you know, we have a lot of people watching our program, and a lot of members of our group and outside the group, they don't all live around here. So
Right.
Would they get whoever they go to, whatever aesthetic clinic they go to get this done, would they just go to the health food store and get their own arnica, or do they usually have it there for them?
Well, it depends. Some places have it, some places don't. You can send them to the health food store. We actually do carry it here, so it's convenient for my patients, but either or. So,
and all places, all aesthetic clinics do not keep it necessarily.
Not necessarily, no.
Right, okay. So let's talk about money a little bit. Let's talk about the aesthetic portion of money, because that's probably the only real answer you have. So if I want to get a vampire facial, what's the downtime on the vampire facial, or was that what you were giving us the answer to?
So by the next day, you're back to work doing things normally. Only the day of, and that's just because, again, the volume of PRP I inject, you'll be a little bit puffy, and the redness. Next day, fine, you can wear makeup. But again, you're avoiding Aleve, Advil, ibuprofen, any of those things you're going to avoid. So if you consider you have joint pain, so that's a little downtime because you just can't take those things, but you can take Tylenol.
Right. So tell us about money, just in vague general forms. So first of all, if we want PRP and stem cell, do they do that in conjunction with a vampire facial, or can you do that separate?
Conjunction, and it can be done at other vampire PRP procedures as well. So
what's the cost generally of a vampire facial?
So generally from $600 to $750.
Reasonable, okay. And then how long will that last? I go get it done. Is it forever, and then you just need to go tweak it, or can it go back in time, or what's the deal?
Well, unfortunately, we continue to age. So even though we do these things to keep ourselves healthy and looking great, we still age. Time still ticks by. So oftentimes when someone first comes in the office, I recommend a series of 3 a month apart. And then after that, every 3 to 6 months, get one, just depending on how we heal and, you know, how long it lasts for us. I have patients that go, wow, I was great for a whole year. I said, that's fantastic. But other ones, I know for myself, I like to get one every 3 months.
Your skin looks great, though.
Thank you. Thank you.
So when they go, because remember, these are people watching from around the world. A lot of them are in our area, but a lot are not. What do they want to make sure they look for, that they have a qualified aesthetic doctor, such as yourself, that is using high standards with their PRP replacement that they're getting from some 20-year-old person? Okay.
So you want to ask about what system they're using to isolate their PRP. Is it truly a medical grade and it's designed to inject the PRP? Okay. If they were drawing into regular blood draw tubes, you know, vacutainers, there are chemicals in there that should not be injected into your face or into your tissue.
Well, so I don't know what that just meant. What did you just say? You said what?
So in a regular blood draw tube, so if you went to go give blood at Quest or LabCorp at the local lab,
yes,
those tubes have chemicals in them that should not be put into your body.
Oh, so you shouldn't use those.
No. So you should be using a system that's specific for injectable grade. It's designed for you to have the PRP put back into your system.
Okay, so we should say, what injectable do you use? What injectable product, or not product, tool?
PRP isolating. What PRP system do you use?
Okay.
Mm-hmm. Is it designed for injectable grade PRP?
That's very good. We got it now. That is so important.
Yes.
So, okay, let's see what else. Tell me a little bit about dangers. What negative could I come across by getting one of these? What's the negatives?
Okay, so anytime a needle goes into someone's skin, there's a risk for bruising. There's a risk for infection. So again, we're making sure that the face or whatever tissue we're treating is thoroughly cleansed. We're making sure that they are using good clinical
grade.
Yes, what they should be when they draw your blood. They're wearing gloves. There's nothing reused from patient to patient. It's all disposable. So the risk for any kind of bloodborne illness is minimized or down to zero. So new things for patients every time.
Right. Yep.
New needles, new syringes, new microneedling tips.
And you know, we're not giving any medical advice. I know for sure I'm not, and I know the doctor's not. She's just giving suggestions. But in my opinion, you could even die from almost anything. So I'd like to even throw that in, right? But you're probably not going to die from this. But I think it's good that you don't know what your risks are exactly, because everybody's different, but they seem to be very minimal.
Absolutely, very, very minimal. As long as your clinician is taking the steps that should be taken to keep you safe.
Right, absolutely. Okay, somewhere online when I was researching, it mentioned something about the word harvest, which sounds scary. Harvest your fat or bone marrow. What in the world?
So that is one way to get stem cells for use for medical treatments. One is through a fat transfer, because fat has stem cells in it. And then they process it down and make it thin, and so it doesn't look lumpy when they make the transfer. Another way is through, as you said, bone marrow. But I personally don't use either one of those techniques. And they can be uncomfortable, painful, significant downtime. They're fantastic, but they're much, much more involved. They're very involved.
It'd be better just to get a donor stem cell, right?
In my opinion, it's much easier for my office and my practice. Yes.
Yes. Okay. Makes more sense.
And so, like I said, but the donors that I have are screened as if it's not me personally, it's a company I use, which I won't mention, but they're follow FDA guidelines. They're screened as if they're donating for an organ transplant, and the tissue is also irradiated, so there is minimal risk.
Right. I don't know if I think you have these, but it seems like a lot of aesthetic clinics and other clinics have regular events to where they educate people on what's going on, even more detail than what you're so graciously providing to us today. Do you all have events like that, or where can the people watching go to ask a question or learn more?
Absolutely. We do have regular events here in the office, and they're welcome to go to my website, GainesvilleAesthetics.com, and ask any question that they feel like. We'd be happy to help them.
Okay, they have a comment section or a place where they can ask you a question, or your assistant?
So they can email directly, they can email in, and then we will get back to them. Absolutely.
Okay. Is there a place on there where they can actually register for an event, or will it show up online, or? They could go to your Facebook or a page.
Yes, Facebook or Instagram, absolutely. So I don't currently have one scheduled, but I will, I'm sure, for February, for Valentine's Day. So if they keep their eyes out, there'll be one.
Okay, great. And if not, I would suggest if they're not in the area and they want to find somebody in their area, I guess they could email you and you'll make sure they find somebody in their area that you feel is qualified.
Absolutely. Absolutely. I'd be happy to help them.
Okay, great. Well, I don't have any more questions, but I've certainly learned a lot from you, Dr. Webb. Do you have
Thank
anything
you.
else you can think of that we've skipped?
That it's very comfortable procedures. We make
Minimal
sure minimal risk. They're very comfortable. We use means to make the patient comfortable here in the office, so they're locally anesthetized. So they're fantastic. They have beautiful results.
risk. When you say the word locally anesthetized, they're just giving like a twilight?
So just like a topical lidocaine, so that when you have the microneedling or injected, that you don't feel much. It's nice and comfortable. It's not scary. And so
It's just
they,
like a topical painkiller?
exactly. So it's a nice experience. So it's not a scary experience. It's nice. It's relaxing. There's minimal discomfort and
Not
minimal.
going under per se.
No, not going under.
Okay.
No, absolutely not.
Great. Well, gosh, I know you've probably answered every question we could think of so far, and we appreciate it. But we will be seeing you next month for another interview, and we're going to be talking about
sexual health. The S shot and the P shot, absolutely. And how PRP and stem cells can help with that.
Yes, the O shot and the P shot.
Absolutely.
So, ladies and gentlemen watching, you may want to go ahead and research just a little bit, and underneath the event tab for this next event, go ahead and put your questions. We'd appreciate that. Thank you, Dr. Webb. Merry Christmas to you too.
Thank you, Trish. Merry Christmas to you as well.
Bye-bye, everybody. Thank you, Doctor.